Okay, I think we're good.
Looks good.
And it didn't even make me sign back in and all that good stuff.
That's great. Probably because I think you're on the cabinet account right now, so that
Yeah,
makes sense, but I'm so glad it worked smoothly.
yeah, seems to be. Hopefully the consensus will be that from those that are trying to tune in.
Yeah, I can actually check that right now, and make sure it looks good.
I was just seeing the pictures from a friend who got the 40 inches of snow
Oh my gosh.
in upstate New York.
Wow. That's
That's a
super
lot of
intense.
snow.
It is. Okay, the live stream looks good from my side. I clicked on it on the website, so
Awesome.
that's fantastic. So Debbie, I probably will reformat that email. It's going to be too much work. There's so much embedded structural formatting with like an email that is so hard to work on and fix, like all the lines and headers, and for some reason it just makes it really tough. So I'll probably just reformat it, but I'll make sure that it still gets uploaded and it looks similar enough.
Okay. Hi, Bria.
Good morning, everybody, and happy Friday. It's great to see all of you. Can I get a thumbs up? Did I successfully share my screen? Awesome. Go team. We will get started in just a minute. Good morning, everybody, and happy Friday. How are we doing today? We're here, we're good, it's Friday, excellent. I'm really glad to hear it. Well, I don't know about all of you. When we started this idea of an early childhood recommendations panel quite some time ago, and then as we were planning for it in March and in April, I don't think I quite anticipated how busy we would feel on the third Friday in December after a really, let's say, a really unique 2020. So I really appreciate all of you being here today. I know that we kind of keep reflecting on that as we're towards the end of the year. I really and truly appreciate the time that you take to be a part of this panel and to come together, put our heads together to work to support our overall early childhood system. Today, I think we're going to have a lot of information, and I think there's going to be good chance for us as a panel to think about how we want to direct our work in the next couple of weeks and months. So I expect that we'll have good conversation and good ideas today. And I also expect that we'll be able to mull on this a little bit and continue thinking about this and planning and visiting with one another as we get into January. So with that, I said thank you. This is a remote meeting. So obviously we're meeting by Zoom because of the coronavirus. The YouTube video live stream of this are on the Kansas Children's Cabinet and Trust Fund website. We all have our good internet hygiene on in terms of making sure that we're muted when we're not talking and all that fun stuff. We have the raise hand feature when we need to share, and we're not having a conversation in the chat bar since that's not something that we can see on YouTube for the people who are following along out there. Hello, everybody out there in YouTube world. So if there are any motions, we'll clearly state that, and then I figured out how to see everybody on my screen, and so we'll be able to clearly announce the results of any votes. This is the draft agenda that we sent out to everybody. We've got our regular business at the beginning. We have our KANSANS open forum. We've got quite a bit of follow-up from previous meetings. We'll have an overview conversation around the process to develop Kansas's Child Care Development Fund state plan for the next round. We'll have some conversation around the Kansas Beats the Virus initiative and an overview of Kansas's COVID-19 vaccine plan, where we'll develop any follow-up questions we have on that front. We will have a big picture conversation around the Kansas COVID-19 response, and then do some planning of our next steps. I will say, as we were putting this agenda together, and then as we were working through the slides, I want to make sure that we're committed to having a break at 10:15 for 10 minutes. So it might be that we, if you're looking at the agenda and you're thinking, oh my gosh, we're not going to get through these early pieces by the time we get to 10:15, we'll take a break at 10:15 so that we can stretch and step away from our screens for a minute. So with that, I would love for somebody to have a motion to approve the agenda where everybody clearly identifies themselves when making the motion in the second.
This is Amy Meek, and I make a motion to approve the agenda.
Thanks, Amy.
This is Eva Horn, and I will second.
Thanks, Eva. Can everybody, we've got a motion in a second. Can everybody give me a thumbs up or some other indication that we are good to go on that? Fantastic. Anybody who's opposed, can you wave your hands really big and say so? Awesome. We have approved the agenda, and then I'd like to do the same thing for the November 20th meeting minutes, which we sent out in a Word document in the start for the meeting. Do we have any proposed suggestions or changes to the minutes? Fantastic. I would love a motion to approve the minutes.
This is Dave Lindeman. I move we approve the minutes.
Thank you, Dave. Do we have a second?
This is Natalie
Cornelia
McLean.
Stevens, I
Second.
second.
Natalie McLean, I heard you first, so we'll give it to you. Thank you. Can we get a thumbs up to approve the minutes? Fantastic. I see that we are unanimously approving the minutes. Anybody opposed? Fantastic. Go team. So the first thing we've got, or the next thing we've got on our agenda is the KANSANS Open Forum. As a reminder, this is an opportunity for KANSANS to share comments with this panel so that they can share their perspective. And we have actually two open forum comments today. The first is Mitch Rucker from Kansas Action for Children, and we shared his written comments with all of you prior. Mitch, we've shared the procedure for this, so you've got about 3 minutes to share remarks with the panel, and then if anybody has any clarifying questions for Mitch, we'll have time for that as well. Take it away, Mitch.
Great. Well, thank you, Madam Chair and members of the panel. I'm Mitch Rucker from Kansas Action for Children. I am the Early Learning Policy Advisor for KAC. And I won't spend the time reading the testimony that Amanda mentioned that was shared in written form, but wanted to touch base with some context around those items. So taking them in order, we will be proposing this legislative session an expansion of the employer tax credit for childcare. Currently, it's vastly underutilized. And so we think that expanding the types of businesses that are able to claim the credit, as well as potentially tweak the reimbursement rate, will actually help it achieve its policy goal of encouraging employers to provide their employees with childcare assistance, and B, bring some new stakeholders to the table when it comes to early childhood more broadly. With number two, Kansas is one of the few states that does not fully draw down all available CCDBG dollars. That's the Child Care and Development Block Grant Fund, and is used to promote early childhood affordability and quality in the states. And I don't think I need to tell anybody here why that's important. But I will say that while this isn't enough money, this won't provide all of the money that we need to achieve all of our goals. We think that it's a good first step. And I would note that last session, we did actually have it in the House side of the budget for this fiscal year. But as they left hastily due to the onset of the COVID-19 pandemic, it was removed in the conference committee. So there is some appetite in the legislature, but we would like to try again when hopefully they don't have to adjourn so quickly. And the third piece with the workforce development and retention grants, this may seem a bit vague with the wording, and that is intentionally so, as the conversations around what we want those to look like continue. We want to continue to engage stakeholders with exactly what kinds of programs I think are appropriate and feasible. So, we would like more input, but think that it's important to get the idea of providing direct financial support to providers so that they can be compensated in the way that they deserve without increasing the cost burden on parents, I think will be very important. So with that, I hope that this panel will recommend to the Children's Cabinet that they support these positions as we move into the legislative session and beyond. The first two items, the tax credit and the CCDBG funding, will require legislative approval. And so we would appreciate the support of this group of early childhood stakeholders as we move in and support these programs legislatively. So with that, hopefully I didn't take the full 3 minutes. We can, great. It's even better, more time for questions. So I will try to provide whatever information y'all are looking for. Thank you.
Thank you, Mitch. We appreciate the comments that you shared with the panel. Does anybody have questions for Mitch?
Yes, this is Amy Gottschammer. Mitch, first I want to applaud your work. This all looks wonderful to me personally, and I thank you for pulling this all together. I did wonder in part one where you were talking about the child care tax credits, and this may be a bit of my ignorance in tax policy or how that works, but what other entities other than C corporations would be entitled to use something like that? Would it be LLCs or sole proprietorships? I'm thinking, can small business owners utilize this theoretically or not?
Yes, that is exactly what we mean when we say the types of businesses. I can't rattle off the list of types of business entities because I don't know them all. All the legal standings, but yes, the idea is that smaller businesses would be able to take advantage of this, and we would also like to target it in a way that would encourage employers. It's not just the wealthy employees that can be getting their childcare subsidized. That it's very targeted with an equity focus towards people who actually need the assistance.
Perfect. Thank you.
Yeah.
Any other questions for Mitch? Great question, Amy. I've got a quick one. When we're thinking about the process, I know it's an uncertain year as we look ahead to 2021, but do we have can you remind us of just the timeline of when the legislature might make some of these decisions?
Yes. So theoretically, in a normal year, they will convene on January 11th. That's the second Monday in January, and will start working through the legislative process in January and February, and then they kind of switch over once bills pass one of the two chambers, either the House or the Senate, and then in March they would go back to the other side of the aisle. And so hopefully the budget process, CCDBG, that one, they could work it in early, or that one could wait until May-ish when they actually finalize the budget in a normal year. But the tax credit will probably be in between January, February, March, somewhere in there.
Fantastic, thanks. Well, if we don't have any other questions for Mitch, thanks so much for joining us today. We appreciate it, and we'll take these pieces into consideration as we're planning our future work. And this information will be posted on the Early Childhood Recommendations panel portion of the Children's Cabinet website. So thanks for being here today.
Great, thank you. Thank you for having me.
Awesome. We also received a piece of written comment to share during this time. It's from Connie Larkham, who is an early childhood educator and provider in Anthony, Kansas. You can see that here on the screen. She shared this as a reminder for folks who might not be able to join at 9 a.m. They're also always able to send comments on to Debbie to be able to share with the panel. And so Connie shared some concerns related to young children who might not have visible personal protective equipment to be able to see some of those beginning speech movements. She also shared concerns about mental health for providers. And then she noted, and I'm going to read these last couple sentences. During the last 90 days, the incredible strain in grant writing, paperwork, increase in COVID cases, low numbers in homes, well, honestly, it's taking a toll on our providers. We need more help out there for those two essential workers. So I wanted to make sure that we shared that today too, so that you had that, and we'll be sharing this. We got it fairly recently, so we'll be sharing this when we share our follow-up materials, our meeting minutes and pieces like that with the panel. Those are our pieces of public or of open forum comments. And so I will turn it over to Debbie Deere to share follow-up from previous meetings. Take it away, Debbie.
Thank you, Amanda. Good morning, everybody. Again, I echo Amanda's welcome to our December Friday, right before Christmas meeting. So thanks for being here. We have a lot of follow-up from some previous meetings. As Amanda mentioned, we've been busy. So if everyone remembers back to our September meeting, we heard brief overviews from several of our panel members who serve on some of these councils and committees and work groups that focus on early childhood issues in Kansas, and we kind of decided from that discussion that we needed to develop a resource directory that would be available to all of the stakeholders to help them understand the work that's going on, and then also allow the panel to better engage with a lot of those groups through our work. And so that stakeholders resource directory is now available and is live and accessible to everyone on the Children's Cabinet website at the All In for Kansas Kids Resources and Reports section. So I just want to thank everybody that was involved in helping share your information in order to put this resource directory together, to all of the staff who worked hard to make it look nice on the website. And then also just encourage everyone to keep contacting me with other groups and information that you might think of that belong here, or if you see your information on there for your organization and it's needs to be changed, please let us know or let me know, because this is a very fluid document. It does have the purpose and the priorities and some of the members that are involved with each of these groups, but that is, as we know, ever changing. So please just let me know if there's something we need to take another look at. And a quick shout out too, because it's not on here, but another thing from the past is that our panel member bios and pics are also live on the website now as well. So you can go to the panel member section and see all of that. And again, if something needs changed, please let me know. Moving on to the work of our continuing work of our kindergarten transitions recommendation and memorandum of understanding toolkit. This is just continues to be great. So as you all remember, last month we finalized and put together a formal recommendation, which went in front of the Children's Cabinet and Trust Fund at their meeting on December 4th. And it was wholeheartedly accepted, which was great news. And so that afternoon, we took it to the Early Childhood Stakeholders Group to present it and then allow them to share feedback on some of their dissemination plan ideas. And obviously the panel had discussed dissemination plan ideas as well in the process of developing this product. And so all of those ideas are going to be compiled. And on January 6th, we have another kindergarten transitions work group meeting scheduled to where we will hopefully finalize a dissemination plan, which will then be put into action immediately. And we're going to get this out to as many Kansas communities as possible to begin using it. And it also is now on the Children's Cabinet website under the Kindergarten Readiness Summit webpage. So you can access that there as well.
And I should jump in and say, sorry, everybody, this is on me for not having the links to drop into the chat bar. But if you go to the Children's Cabinet website, these slides are posted on our panel meeting materials. And so you can get to all the hyperlinks from there. Sorry, Debbie.
Thank you. Another very important conversation that took place at the September meeting of the panel was some COVID-19 response discussions. We were 6 months in and we just wanted to hear from everyone how it was going and what was happening. And so an important piece that came from that was the comments about childcare providers needing to find a way to have paid sick leave and the challenges around that. We all know that providers, especially home-based providers, but many others as well, frequently work when they're sick because they simply just can't afford to close for the day, or they don't want to ask the parents to not have to have care for the day. That's a very big challenge. And so we are looking at supporting ways that we can empower providers to tell families that they need to be able to take sick days to take care of themselves and their families, and having the financial support to do that, whether it's through subsidies or their own programs policies. So we decided to try to do some research in that area and find a way to allow families and providers to succeed. And these are some of the links to the resources that we used while we were doing this research. So we know that there are many states that have laws in place that do require employers to pay their employees paid leave of some kind, but most of the time these are unfunded mandates, and that leaves the employers to find the sources of revenue to pay these extra wages. So we've talked a lot, Kansas included. There's many states that have broadened temporarily the access to paid leave in response to the impact of the coronavirus, but there's really no permanent or broad paid sick leave measures that have been adopted yet. So this is not going to be sustainable. I was not able to find any policies or initiatives that support paid sick leave specifically for home-based providers. With the CARES Act funding, it does state that states are encouraged to have childcare providers use a portion of those funds for wages and salaries of staff. But again, it's going to be up to the discretion of the finance manager of that program to decide if they're going to allocate these funds to staff when they're absent. Most of us here know that the options to secure revenue for providers are subsidy payments, grants, government funding, and then parent pay, which is the most common. And right now, the national average annual cost of childcare is 10% of a married household's income and 34% of a single household income. Childcare Aware of America just recently did a study this fall, 2020, and out of that came building a better system will require three things. And again, a lot of us know this: public investment, a solid data foundation, and resources and supports for families, children, and providers. So Amanda, you want to take it from here?
Absolutely. So thank you, Debbie, for pulling those resources together. I wanted to take a pause and see if panel members have any questions about any of those follow-up pieces that we shared today. I also wanted to highlight that Debbie's continuing to collect these types of national reports. I know that we've seen a number of pieces come through. Peggy, I know that there was something that you shared and found just this last week. And so as people are finding those, please do be sending those to Debbie so that we can add those to our kind of growing library of pieces that we're looking at. And if you've got ideas about how we can make these resources really helpful and useful to all of you as panel members, please do share as well. So are there other pieces that come to mind that really we want to make sure are on our radar as we're considering what's ahead? Emily, I see that you've come off mute. Go ahead.
As a home-based childcare provider, I want to say thank you to this group for initiating this conversation, for taking what was discussed in September so seriously, that we have this formal opportunity now to put forward the conversation. At this moment in time, I don't have any other suggestions right now, but the conversation is so critical, and knowing that it's here, even just in the last 2 weeks, I've had situations where I've had to consider how to handle it. So thank you. I just want to put it out there. Thank you that we can have this conversation openly and honestly.
Mm-hmm. Absolutely. And thank you, Emily, for sparking the conversation back in September. All right. Well, we will continue to mull on these pieces to keep these pieces in mind. The next item on our agenda is Kansas's Child Care Development Fund State Plan. Now, I do hope that in preparation for this meeting, I hope that nobody attempted to read the entire 300-some pages of the state plan. That seems like a whole lot for a December afternoon, no matter how cold and dreary it is outside and how nice and cozy it is indoors. I would love to turn it over to Michelle Adams from the Kansas Department for Children and Families to talk a little bit about what we can expect in this area in the coming months in Kansas.
Thank you, Amanda. So I'm Michelle Adams, and I'm the Early Education and Child Care Services Manager at the Department for Children and Families. And DCF receives the federal funds from the Office of Child Care through the Child Care Development Funds, as Mitch had mentioned that earlier. So for a majority of those funds, they have to be spent on direct services like our child care subsidy program. But there is a portion of those funds that we can use to spend to improve the quality of childcare and other additional services to parents, such as the resource and referral counseling that we provide in Kansas for help in selecting childcare providers. The primary goal for these funds, though, is to help low-income working families to increase their access to affordable, high-quality childcare. So every 3 years, we turn in a plan, a state plan that lets the Office of Child Care know how we're planning to use those funds. But the state plan also helps us to plan for the future. We're starting some of that initial work for our CCDF state plan for 2022 through 2024. And so very soon, we're going to have to plan some meetings with agencies and early childhood partners throughout the state. And during those meetings, we will discuss our current activities, the CCDF requirements. We're going to discuss how the early childhood PDG related work helps inform these sections. We'll want to gather input, though, about what everyone thinks is working well, what's needed, and what might not be needed anymore. Keeping in mind that some of the activities are required, and we'll include that information when we have these discussions. So because like Amanda said, the plan is 300 and some pages, we are planning to do this in separate meetings for separate sections of the plan because there's a lot to cover. At this time, we've kind of looked at the different sections, and we have identified 6 major groupings for some general topics. We want to try and have these meetings in January. We know this is a very busy time, but we think each meeting should be at least a few hours each. We received feedback that it would probably be easier to have these broken up in this manner as opposed to one long meeting. And we're asking that different people be invited depending on each topic, but in general, there's some representatives that are required. And we do plan to invite the members of the Early Childhood Recommendations panel to these meetings. I did want to kind of touch on what the general topics will be a little bit. So one of the topics is our section 1 of our state plan, which has to do with our disaster response coordination. So we already have defined roles through the Kansas Response Plan with the Division of Emergency Management. But we do need to kind of regroup to go over what we've learned so far and what we might be able to do better after this pandemic or during this pandemic as it continues. CCDF requires a child care disaster plan. We have one, but it is basically a summary of all the disaster related activities that are currently taking place in childcare. We do have a need to have some more discussions related to the tracking of the childcare providers' needs for future disaster funding opportunities from CCDF. Like the disaster funds, they did issue now some funding to help providers who have experienced disasters to recover from those events. And there's also, we received the CARES Act funds, and we've had to try and respond to the needs of the providers. So we'd like to have some discussions around that. The section 2 is really about outreach and consumer education. And we feel like that aligns real closely with the goal 3 in the strategic plan around family knowledge and choice. So we're seeing some very clear alignment between the CCDF plan and what's required with those fundings and what we have developed in the strategic plan for the state. In section 3 and 4, the state plan is about increasing access to quality childcare. And we think that that kind of aligns with goal 5 in the strategic plan about capacity and access. Section 5 is the monitoring process, which probably best aligns with the goal 7 in the strategic plan about quality and environments. And then we're seeing section 6 in our state plan, which has to do with the recruitment and retention of workforce, which probably aligns best with goal 6 in the strategic plan around workforce. We also, in section 7, it's about supporting continuous quality improvement, which we believe aligns with strategic plan goal 7 about quality and environments. So we're seeing such alignment that we feel like these discussions need to take place and that the recommendations panel should probably be involved in those discussions. So during the meetings, we want to talk about ideas on what might be the best way to gather future input for these major topic areas. There might be some existing subgroups for these major topics, like for instance, we have the Workforce Development Advisory Group, and that would make sense for ongoing input regarding how we use the funds to meet those needs in Kansas, and then also the CCDF requirements at the same time. These planning meetings aren't intended to take the place of the public hearing. So we will have the public hearing, but it'll be at a later date. So we plan to send out invites soon, and I didn't want anyone to be surprised when they receive those invites. And there will be more information sent out when we do that.
Awesome, thank you, Michelle. And can you remind us, I know we're working on a really a tight timeline to get a pretty big project done. Can you remind us about when this final product is due? Due might not be the right word. When we're hoping that it will be done?
Well, we would like to have a kind of a final draft before April.
Awesome. So a great opportunity for us all to roll up our sleeves and really get to work. Panel, we had a really great conversation at the end of our November meeting where we were thinking about future work. And one piece that we flagged was, a statewide comprehensive coordinated plan around supporting childcare. And Debbie and I took that and we're debriefing from the meeting and we looked at each other and said, gosh, that's a pretty tall order when we're thinking about what's ahead. And then it was really serendipity. It was I think later that day or that week that we got connected with DCF and realized that actually a lot of this work is underway, that there really is this state plan where we're able to say, all right, this is a really significant amount of money. There's great opportunity to align this with the strategic plan, which I know many of us worked really, really closely on developing. And I think that that is going to give us great opportunity for us to consider how we use those resources and how we're able to move that work forward. So thanks for indulging my commentary there to give some of the background as we're thinking about why we wanted to share this. Do we have any panel members? Do we have any questions for Nichelle on this topic as we stay tuned for those upcoming meetings? Go ahead, Emily.
Hi, this is Emily Barnes in Olathe. Thank you for bringing this up again. My question is, how are we going to make sure to engage interaction with childcare providers? Directors, yes, but specifically the family childcare provider who is working during the day while many of these meetings happen. Will we make sure that as this gets rolled out, that there is active engagement so that some of these meetings specifically really important ones that directly affect our ability to work and ability to develop our programs, that we have access to these meetings in times that we can actually get there. I'm trying to make sure to point out to people, there's been a lot of effort put towards informing providers, but we also need to include that we need to engage with providers and get them a part of the conversation. And much of that means we have to do it at times that the provider is available. It is not easy for the majority of providers to be involved in meetings during the business day.
Thank you, Emily. So part of the discussions that we want to have during this meeting is how to best get ongoing input on our state plan, but also I think it probably coordinates so much with the strategic plan that I feel like it might be able to be combined, but I think we need to have those kind of discussions during these meetings. So these meetings will be to help plan ongoing planning.
Okay, so talking about things like disaster response and outreach and recruitment and retention, that we're talking about planning on planning. How does it, so April's, the final product in April is, that's how we take things forward. I just sense that if these things happen in a way where childcare providers are not actively engaged in how the discussions go on, much of the sentiment will be that the decisions and the brainstorming was happening to them and not with them. And I think that we need to come around the front end and be very active in how we include providers in this planning to plan, because the level of commitment that I have seen from providers in the last 9-10 months is huge. We are invested in our field, and part of the conversation I think needs to be in how do we bring childcare providers actively into some of this planning and this brainstorming on how to create.
So Emily, our state plan is a fluid thing. It's very fluid. And we make amendments to it throughout the process. And so what we have in place starting in April doesn't mean it can't change based on the feedback and input that we continue to receive. I hope that helps.
Thank you, Emily. Thank you, Michelle. Peggy Kelly, did you have a question?
Yeah, I just wanted to, first of all, Nikki, thanks for running this, and I really appreciate the way you're checking out the input sessions. I think that'd be really helpful. I was curious I know you said that the subsidy is really aimed at supporting working parents with the cost of childcare, and I know we all agree that that's really important. I was curious if there's any flexibility in this upcoming state plan to add to the capacity to support parents who are also furthering their skills in education, finishing up a GED, a high school diploma, or getting some sort of college or post-secondary skills to increase their ability to earn and support their families as well.
Peggy, at this time, a lot of those requirements are in statute. So it would probably take legislative change to make changes to those policies.
Thanks.
Thanks, both of you. Do we have any other questions for Nichelle?
I do, Amanda. This is Cassandra Sines. I just kind of wanted to piggyback on Emily's comment about having input from the providers on the front end rather than on the back end. Being the family delegate for MCH Title V, they are all about getting the family's perspective on the front end, so we don't have to make changes on the back end. And that just makes more sense to me. And if we have the provider's perspective on the front end, then we're not making changes that would be beneficial to the providers on the back end, because you're getting that input that's beneficial to them. It's just, to me, it makes more sense. And I definitely see Emily's point. If you're going to be making changes and then telling them what you're doing, that's not helpful. You know, if you have their buy-in from the beginning and you're working together to make a systemic change, then they're going to have more buy-in and be more apt to work with you than against you.
Thank you. One thing I am realizing is that we did all this work as a state to gather information for our through our needs assessment. And all that information, like I said, these goals that have been developed really align real closely with the CCDF plan. And so we have on the front end gathered a whole lot of information about what the needs in Kansas are that we can use to help inform these decisions. But I completely agree that we understand that to get full involvement and input from everyone that it touches, that we might have to have meetings outside of normal times. And that's what I think that we need to really discuss during these meetings.
This is Emily again. I can also tell you, based on that needs assessment, when I speak with childcare providers around the state, most were unaware of that. I know that there was a lot of effort in going through to try to get information and feedback. But I can tell you, when I speak with providers around the state, most often I have to go back and explain what has already been done and what it means and what it's intended to be used as going forward. So I can, at least from my personal perspective, I see a disconnect when it comes specifically to childcare provider buy-in and understanding of what's going on. And so I'm just trying to help put out the information that, or the conversation that we need to discuss it and hopefully come around the front end of it.
And Emily, I'm curious, as you're thinking back over the last several years, have there been engagement opportunities, or have there been state initiatives where you feel like there's strategies that we might consider moving forward for these kinds of things?
As far as initiatives to engage with childcare providers from the state level down, it's been everything during COVID. Mm-hmm. Before COVID, we would get emails that we may or may not catch as being important. Mm-hmm. If we caught that they were important, we may or may not have understood what the purpose was. Like I remember getting the emails about, wanting stories and survey feedback and things like that from when the needs assessment was open and active. But I didn't understand it. My surveyor did not actually work with me to try to, there was never from the county, hey, here's what's going on, and this is what we would like. If there was, I missed it in an email, but it wasn't ever discussed in a review, in my inspection. In the grant programs, I've participated since 2014 in the Child Care Aware grant programs through the Family Conservancy. I've been both a participant and a mentor consistently, and there never was discussion in those opportunities. And so I know that just knowing you and knowing the Children's Cabinet, I know considerable effort has been put forth. I'm telling you though, as a child care provider, we were not linked in until all of a sudden there's information that already exists.
Thanks, Emily. I think that that's really helpful for us to consider moving forward, especially as we're considering that, like, that how to break through piece, right? I think that if we had the magic sauce to be able to say, yes, this is really the important email that you want to make sure that you read, I think that we would probably be able to get quite a bit of demand if we were trying to go into marketing elsewhere. So I think those are really helpful pieces for us to keep in mind as we are considering engagement strategies, both for this and moving forward.
Amanda, this is Melissa. Can I just make an ask of this panel? I think this is I mean, it's a conundrum that we all deal with on the agency side, is how we improve the engagement with the parents and families and providers and that universe of folks that our programs are designed to serve. I'm wondering if this panel can maybe workshop a little bit around some strategies. Emily, maybe you could bring, on behalf of your network of providers, some suggestions would be helpful, because we have tried a lot of different strategies throughout, particularly this past year. I know I've personally spent some Saturday mornings giving webinars and evenings trying to come up with those non-traditional hours outside of your childcare workday. We email, we post online. Help us better understand what types of communication and methods might be helpful. I think that would be a really useful exercise for the recommendations panel to bring forward, because all of the agencies are involved and listening, and I think we're all willing. I know that. And I know, Nikki, I want to thank DCF for opening up the process of the state plan. Even the series of meetings you've already got scheduled is new and different and improved over what has happened in past state plan writing cycles. And I do want to acknowledge the effort that is being made to open the process up for input. So I think we can get to a place where whenever we have a project like this, that whether it's just good sense that we take input to help foster relationships and buy-in, or whether it's a required element of a project, I think we need help understanding what it is you need on your end as a home-based provider, what our parents and families need. That would be really helpful for the panel to workshop for us.
And I completely agree. And I'm personally committed to helping try to find some answers on that. I will commit to this group that I will be a part of that conversation and figuring out how do we go forward and how do we find success together. Because I know everybody is working hard and we have more common ground than we don't.
Emily, this is Amy Gottchammer. It seems like maybe part of the answer is just in the things you said, that it's in my mind, it sounds like word of mouth, that it's the things that you're doing, that you're going out and you are telling people. You mentioned, well, if my licensing surveyor had said this, it sounds like you're talking about face-to-face conversations. So if there's a way, maybe it's not the licensing surveyor, maybe it's somebody else, maybe it's resource and referral or something else, but it's those face-to-face conversations that are maybe really hitting home.
Thank you.
I agree. And I think there's a lot with when we now know, hey, here's this conversation, I can start having it with childcare providers, and you guys can start having it within your organizations, and we can start putting out, when I know that there's an event, I can start saying, guys, like, this is really important. Please tell everybody, and so that the word of mouth and I especially in COVID, I have really come to this idea, let's not invent new wheels. Let's use the wheels that we already have. And so I'm certainly not going to suggest let's, create a new system. Let's utilize what we already have in place and work together to use it effectively.
Cassandra, I saw that you came off mute. Did you have something to add?
Yeah, I was just gonna say, with my experience with the Family Advisory Council, I would be happy to help in sharing as well.
Fantastic. Well, thank you. I appreciate it. And Melissa, thank you for the idea and the suggestion. I think that's a good tangible thing that this panel can work on. Spoiler alert, later in the agenda, we'll be talking about some of our next steps, including what work groups we might form to move our work forward in the new year. So we've got a running list of opportunities, and I think we'll add this to it as we're thinking about places where we might recruit people in to do some targeted work to develop recommendations. So I really appreciate the conversation here. I think that we've got to a good place here. Michelle, I want to echo Melissa's thanks in terms of sharing this and in terms of the engagement as we move this really important piece forward. So thanks for previewing that with us today. Next, I'll turn it over to Debbie and Melissa to discuss something that I think we're all really excited about, which is how Kansas can beat this virus. So take it away, ladies.
Well, thank you, Amanda. Yes, just very recently and very rapidly, the Kansas Leadership Center has launched what they're calling their Kansas Beats the Virus initiative, which is a bipartisan health partnership with the state of Kansas. And so the Leadership Center called or challenged, I think, its partners and alumni to hold 1,000 community meetings around the state by the end of this month. So they're being very aggressive with this idea, and hopefully those meetings will encourage local groups to gather and generate efforts to reduce the spread of this deadly virus as it continues. And so we're looking for local solutions that can keep Kansas healthy. And there's a lot of groups that have risen to the occasion. So you can find more information on this on the Kansas Beats the Virus webpage at the Kansas Leadership Center site. So Melissa Rooker rose to the challenge, and she volunteered to coordinate one of these meetings. And so she was able to gather a group of recommendation panel members who are also Leadership Center alumni. And they had a meeting on December 14th. We met on, I was included with that group, and we met on Monday. And there was a Leadership Center staff Kansas Leadership Center staff who facilitated the meeting. And really the goals were to try to coordinate with the group or the panel group to form an action plan to combat this pandemic, and in what way they would choose to do that. And so they had to commit to carrying out the action plan in a very time-sensitive manner. And there is grant funding available up to $3,000 for this project, with a very speedy deadline coming up. And, the group can determine whether or not we need to use that funding in any way to do the project that we chose. And so during that meeting, the action plan that our particular group discussed was to create a social media campaign throughout the early childhood network. And we just got done talking about how big that network is. And a lot of times when I think about the early childhood network, I just think about this great big spider web that's spread all over Kansas, and all of our early childhood professionals are working hard in every corner of the state to get this work done. And so by doing this, we would access the Children's Cabinet Twitter account and the website, along with panel member agency and organization individuals and groups that also have websites that they could share our information on. And so taking this project and identifying talking points for continued practice safety measures, committing to create a positive message around wearing masks, social distancing, and avoiding large gatherings for however much longer it takes to get through this pandemic. And so there was also discussion around creating a catchy slogan that might go along with that messaging, and creating our own hashtag as well. And then the Leadership Center also asked us to make sure that any messaging that we do also includes their hashtag, which is KS Beats the Virus. And there was some really fun ideas discussed about using pictures of children to message these safety practices in fun ways that they're doing that would resonate with everyone. So our proposed next steps that have been talked about is that a tweet will go out from the Children's Cabinet at KCCTF this week. And there needs to be some group discussion around, the messaging of that tweet. And I know that that's something that Melissa was looking at, so she might be able to speak more to that.
So actually, Debbie, yeah, our cabinet, the first tweet went out this morning.
Okay.
That brings attention to the Kansas Beats the Virus program. And then we're working on one. There is on the CDC website, there's a great section that talks about how to manage the holidays safely with families that I think later today, that will be tweeted out. But I think the point is to broaden it beyond our we'll provide some baseline tweets through the cabinet. I don't necessarily need input for that. But what we're asking is that all of you workshop some messaging and create this is kind of trying to create a grassroots campaign that among your organizations and your spheres of influence, that this becomes something that is built on through the common hashtags and messaging. I think what was suggested in the group meeting on Monday is that, within the, working with families who are willing to create some messaging involving kids sharing the message that, from their perspective, a couple members on the in the team that met said they thought they have families that they will get permission from and do some videos that they can share on their Facebook and that sort of thing, with kids sharing the message, so that maybe it lands a little better with people to hear it from a child's perspective rather than being mandated by the government or however it's perceived. So I think our thought is that the initial work group was, we were limited by KLC to a small group. They wanted no more than 15 people on the call. So we chose to work with the KLC alum on this committee, but the panel can play a role if they're interested folks to create a work group and choose some of the specific steps in our action plan.
Yeah, so if anybody that's interested, so here we are talking about another work group. As Amanda mentioned a second ago, we're developing this, or I guess expanding this work group, because the team that started this conversation on Monday, plus anyone else who's interested in joining us. So please reach out to me and let me know who is interested in doing that. And then we will continue taking this action plan and going further. And the idea behind the kids messaging some of this or helping with this was, I think it was brilliant. And one of the ideas that somebody said is their inspiration came from watching a child that was, Zooming with their grandparent, and just, messaging from them, wearing your mask is important so that you can go, see your grandparents again someday. And also if the child can handle this and wear this mask and be successful at it and accept that, then hopefully they can message that to all of the adults around them as well. So some of those ideas were really great ones. So please let me know. And then we'll get this put together and try to get it going in January. I think, was that the last slide on that, Amanda? Yeah. So if anybody has any questions, that would be
great. Just add that this will continue once we get to a place with vaccine rollout where it's more widely available. That will be wrapped into this project. as appropriate. I mean, it's a little soon right now because we're not the frontline healthcare workers that are getting vaccinated, but this spring we anticipate childcare being part of the group that expands into the group getting vaccines offered, and by summer it should be available for more of us.
And that transitions us really nicely when we're thinking about the next item on our agenda. We are going to be talking about the vaccine and the updates and any questions this panel has in just a second. So I want to acknowledge that we're getting there. Amy, I see that you've come off mute. Would you like to share?
Oh yeah, this is Amy Gottschammer. I was just going to make a comment that in an effort to not reinvent too many wheels, that certainly there have to be a lot of communities that are already working on various messaging. And, you know, I'm sure a lot of the communities have emergency management systems and they're putting together public information, you know, PSAs and that type of thing already. So maybe, you know, whoever the group all ends up being can go back to their respective communities and borrow some of the language and modify it to be used with children, but it might help get you those jumping off points. It's just a thought.
That's what's anticipated, is that we refer to credible resources as the source of the information, and then translate it into kid-friendly, family-friendly messaging that will be just more easily received than those official public health notices, that sort of thing. Thank you for that.
I'm taking notes frantically as we speak so that we can capture all of these ideas.
Do we have any other questions, ideas, or discussion here?
Sarah Rivers. My internet just flaked, so this question might have been asked, but I'm curious why the focus on Twitter versus other social media platforms.
Twitter is what the cabinet has as the starting point. That is not the be all end all. That's what we are encouraging other platforms through other organizations, but the cabinet doesn't have Instagram or Facebook or any of those other platforms.
Great point, Sarah. Appreciate that. And Melissa, I appreciate the clarification too. All right, well, we are incredibly running exactly on schedule. So let's visit about the Kansas COVID-19 vaccine plan. Kudos to this group for, it was our last meeting a month ago when we said, gosh, we know this is coming and we should start visiting about it. In thinking about how we wanted to spend the time, I feel very confident that the good folks at the Kansas Department of Health and Environment who are managing the vaccine distribution plan, that they're committed to public engagement. And I also feel quite confident that they are likely very busy right now. And so as I was thinking about the best, most efficient way for us to get information to the panel, I really appreciated that they shared some written pieces for us. And then I'm also really glad that Melissa is here, as she's been serving on the Kansas advisory group that is helping to move this work forward. I do want to caveat, one, I'm not an expert in vaccines and have not planned to be in the past. So the language on here is from the scientists and the smart medical folks, not from Amanda. And two, I want to share that our goal today is to gather questions. We know that these pieces are new and that many of these plans are still underway. And so to me, as I was thinking about the role of the panel, it felt like a good next step for us was to make sure that we had a good, clear list of the questions that we have about the work that's ahead as we're moving forward. So with that caveat, I'm going to recap. This is the information that we shared in the email, but I want to recap it quickly for the folks who are listening online, who can also go to the Early Childhood Recommendations Panel website to see this in writing and to get the links. Kansas has a COVID-19 vaccine webpage, and that webpage has weekly updates in English and Spanish that are posted on Wednesdays. It also has the state vaccine plan. So you can actually go and look to see, here's what our plan is for the vaccine in Kansas. And we had shared a version of that out with the panel after our November meeting. There's also, as we're thinking about the grand scheme of how this works, There's a federal structure here from the Centers for Disease Control and Prevention. They have an advisory committee that has recommendations for states. And those recommendations are for states to target healthcare personnel and residents of long-term care facilities initially. There's also a link if you'd like to go in and read those recommendations to see how that advisory committee is functioning. When we think about Kansas, per those recommendations, the initial vaccine distribution has begun since we shared out this information. I certainly have loved being able to see the hopeful social media posts and really envision that light at the end of the tunnel. And so that initial vaccine distribution is currently geared towards healthcare associated workers and long-term care residents and staff, which is in line with those federal recommendations that I just discussed. As the vaccine supplies increase, there's additional populations that will be targeted with the general population expected by late spring, early summer. And then kudos to Melissa for catching. So we had the information that we shared had been older prior to the CDC actually approving the Pfizer vaccine, and that vaccine, the CDC approved, or not the CDC, the FDA. The Food and Drug Administration approved for individuals younger or for individuals 16 years and up. And this is the place where I'll turn it over to Melissa in case she's got pieces to add. But Kansas has the COVID-19 vaccination program implementation committee, and that's in place to really advocate for and develop strategies to ensure equitable access for COVID-19 vaccination services. So rest assured that early childhood is there at the table as they are moving this conversation forward, and that the goals of the committee are really twofold. One is to inform decisions related to distributions of the vaccine, and two is to develop communications that support that process. So Melissa, anything to correct, anything to add?
Yeah, Amanda, thank you. That was a great recap. So yeah, we're not planning all this. We are advising on the plans that KDHE has worked out. I would say, as an update, last night, the special committee recommended the Moderna vaccine for emergency use. So there is additional steps in that process, as we saw play out last week. But the anticipation is that by sometime this weekend, there should be that second available supply of vaccine. And I think Moderna has larger quantities and it's slightly less rigid, and it still has to be kept cold, but it's not like the super duper cold that the Pfizer vaccine has to be kept at. So it's a tiny bit easier to transport. So I just want to set the understanding and expectations of what we're doing on this committee. We are in an exploration phase right now. So I don't have answers. I don't have a definitive timeline, and I don't have a definitive set of definitions for each group. There is nuance to every single category on the list. So it ranges from healthcare workers and long-term care staff in this initial very limited round to later rounds that are things like EMS and frontline public health workers, first responders, essential workers, and our critical care infrastructure, teachers, school employees, and childcare workers, high-risk individuals. Each and every one of those categories was the subject of a lot of robust conversation. Long-term care. Well, are we only talking about the elderly who live in congregate settings and nursing and assisted living facilities, or does that also include folks in long-term care for developmental disabilities that are a much younger age group? So we are in the process of responding to a questionnaire that KDHE's vaccine, the smart people at KDHE who are managing all this developed a questionnaire that each of us on this committee is required. That is our homework, and it'll be the week in between Christmas and New Year's, that we reconvene to work through responses to that questionnaire. We had questions to gain a handle on how quickly we process through the different phases is going to be contingent on how many folks they estimate are eligible in each category, how much vaccine supply is available, and then the unknown is how many of the eligible folks are willing to receive the vaccine. So there's a lot of moving parts, and I don't pretend that we're going to be able to define specifically that starting May 1st, you will be eligible to do it. But we can wrap a framework around this. They are using, as Amanda pointed out, national framework models. So this is not being invented by Kansas, Johns Hopkins University, and the National Academy of Science, Medicine, and Science, Engineering, and Medicine are the two frameworks, plus CDC guidance. I do want to focus a little bit on the category that affects our world. Childcare is the definition in this category. We know that means many, many, many different things in many different settings. K-12 has a seat on this committee. It's Brad Noonswander from the Department of Education. Brad and I are collaborating on our responses to the questionnaire because we know there's overlap. There's Kansas preschool programs, there's Head Start programs, there's home visiting programs, there's Part C programs. There are all sorts of different programs that overlap with school operations. So we are working together, and I just want to promise you that we are factoring in all of that, all the different conditions that we need to be thinking about. I have heard from some of you, and I would just say I welcome input. So if anyone wants to reach out to me one-on-one, please let me know. I would say your feedback before Christmas would be appreciated so that I have time to process and provide, weave that into my response. So I happy to answer any questions today that you might have to the extent that I'm able.
Fantastic. So panel members, expectation setting, our expectation is not that Melissa will answer the list of questions that we have, but our expectation is that we will develop a good list of questions so that we can continue to do this work. So I'll open it up to see what questions we have regarding Kansas's COVID-19 vaccination strategy.
This is Amy Gottchammer. I just have a question or a comment, maybe. In some of our discussions with early childhood directors in our community, with the vaccines coming, questions that we know will come to us are, I've had my vaccine, do I still have to wear a mask? I've had my vaccine, do I still have to quarantine? Questions that we'll probably get mostly from staff, but could come from parents or other people that are in or around the children in our buildings. So, and I know it's not limited to childcare, but we would really, really appreciate coming from KDHE some strong language on that. I've spoken with infectious disease experts, doctors in our community, and their response to those questions was stay the course, keep wearing your mask, stay 6 feet apart. Which is great, but I would just like to see some, PSAs and public information coming down from KDHE that reiterates that, so that it doesn't just sound like it's coming from the various directors of different programs. It's coming from higher up, and we can just say, look, that's the way it is. That we have to keep wearing our masks, and we have to keep staying 6 feet apart and quarantine, etc.
Yeah,
that's great feedback.
Maybe let me repeat back. So will KDHE be issuing guidance around wearing masks and social distancing and quarantining for individuals who have received the vaccine?
Yeah, and the stronger that guidance can be, the better. That would be appreciated. Thank you very much.
And Emily, feel welcome to go ahead.
Yeah, I just wanted to comment. So I'm Emily Killow. I'm a pediatrician at Children's Mercy. And I think exactly what you said just is the message that we are trying to put out to from Children's Mercy. And I can pass that on to our folks who are doing kind of working with different news agencies and all of that too, just on that type of communication to include childcare providers and facilities as well. So I'll pass that on to our communication team. But exactly what you said is our advice, is that yes, you still have to mask, you still have to distance, stay the course. So you're right on, but I'll pass that on here as well.
Thank you, Emily. Cassandra, would you like to go ahead?
Yeah, and Melissa, I'll reach out to you separately too, but I guess my concern, I have a son at Heart Spring residential, and from what we're understanding as parents, Heart Spring's kind of getting mixed messages from KDHE because they're considered a long-term residential, but it looks like they're being put like in the school setting. So it's kind of like,
Cassandra, that's already a topic for discussion. So it's on the radar already. There is awareness that there is this differential. This initial round is so limited that I do believe they are focusing on the frontline healthcare workers that have to treat COVID-19 patients when they come into our hospitals and healthcare settings, and the kinds of facilities that our elderly population is living in. But absolutely, there will be the next step will still be, it's considered, this round is categorized as very limited. The next step will be limited, but I think the anticipation is that it begins to open up to more of those congregant settings. So I will carry that concern that it has been voiced that a congregant setting, no matter the age group, there is heightened risk, and I will carry your concern, but I do want you to be aware it has already been noted.
okay. Thank you.
And so Cassandra, to repeat back as we're making sure we've got our list of questions, is a facility like Heart Spring considered a long-term care facility or an education setting?
Correct.
What other questions do we have, panel members?
This is Deanna Berry. I just have a couple of quick things. One question that has come to me from staff that I hadn't anticipated, so I'm just throwing this out there as food for thought, is will home visitors, will people be required to take the vaccine? Which of course I have deferred on that answer because I think that's guidance, and I think, probably cannot be done, but just that's come up. The other thing, Melissa, you mentioned Part C. I'm glad to hear that particular segment is being talked about with home visiting, because we have that added concern of medically fragile kids that, we're going house to house. So, as those plans are laid out, I'm sure there'll be a lot of discussion about where that fits in. And I think about like technology assistant waiver nurses and all those folks that may be, going into some of those homes and having to prioritize. So
absolutely,
thank you.
Melissa, this is Kelly France Langford, and I just wanted to echo what Deanna said as far as highlighting our Part C Tiny K networks. When you say limited and having a K-12 representative, and I'm glad we also have a home visiting representative, but I also want to make sure that our Tiny K networks are highlighted in that, because we have mandates to serve children and provide those special education services, both for our teachers and our therapists. And so as in the same way that school districts are obligated to serve their children, we have the same obligation in birth to 3, which I know you've always been a champion of Tiny K networks.
And we'll continue to champion all that exact situation. So that will be part of what I submit is that type of, they're looking for the kinds of things that create a vulnerable population or special conditions that need to be considered.
Thank you very much.
Yeah.
Go ahead, Cornelia.
Hi. So I guess I would ask maybe for a little more earlier, there was a recommendation that they are very specific in terms of childcare, industries and how all this is impacted there. KDHE has guidance on their website for childcare centers, but that hasn't been updated since like a really long time. And so there's been a lot of changes or nuances that have happened in the world of COVID since then, but that has not been updated to address any of that. And when I asked for guidance, for example, even just about the quarantine time, I was told that it should be at the county level, that those decisions are made. But that doesn't really help us when we're trying to explain stuff to families, because they're leaving it up. And so without having something that's a recommendation, like in that black and white, there in terms of their recommendations. And I know it's a recommendation, I get that, but that really helps us in knowing what our policies need to be, in the things that I write in terms of an organization. So if that can be updated with whatever their guidance or recommendation is for child care centers, so that we have that to use as we're forming our policies for our centers, that would be great.
Thank you, Cornelia. Yeah.
This is Lori Kravitz. If you don't mind, I'd just like to speak to that very quickly. We are doing our best to keep that updated. And as you said, we have not been specific about quarantine, with the exception of referring back to the general KDHE guidance and the CDC guidance. And we won't be more specific than that, because we do need to allow those local health departments, they have that authority to impose something more stringent than what is required by CDC or what is recommended by CDC or KDHE. So we need to keep that flexible in knowing that the local health department can impose quarantine measures that are more stringent. So I know that makes it difficult. This is where we would just ask you to, if you do have concerns and you're not getting answers specifically, to maybe contact us directly and let us help you work through that. We do want to help you, but unfortunately there are some things we cannot write a specific FAQ for. This would be one of those we just can't. We're going to have to continue to refer back to general guidance. With regard to the vaccines, I made a note, we will be updating regarding masks or anything else like that. So, but if you see something else that's missing on those FAQs or updated guidance for providers, please feel free to send us an email. We don't want to miss anything. We want to help support you in any way we can. So, and if you want to have a one-off conversation regarding quarantine and guidance, I am happy to meet with you at another time, if that's okay.
All right, everybody, this is a really important conversation, and we're going to make sure that it gets the time that it deserves. We also, I did not honor a 10:15 break, and I want to honor a 10:20 break. So I'd like to propose that we break for 10 minutes and that we come back and then continue making sure that we've got a good, complete list of questions. Does that sound good to the group? Fantastic. My clock says it is 10:22. We will be back at 10:32. Welcome back, everybody. We can get stuff rearranged. So Bria, I'll share my screen again. There we go. Perfect. Here we go. Welcome back, everybody. I hope you had a nice 10-minute break. Definitely, I appreciated the visual cue and the reminder that it's good to get up and move around, especially on a Zoom meeting. So I know that we had a couple of other people who had questions, and I've got a pretty good list here. Cornelia, did you get the pieces did you have additional pieces about forthcoming guidance for childcare? What I'm trying to say is, did I cut you off before we were done with that piece?
No. So I can follow up with her, if in fact I have specific things. I know that there's the move or the desire to send a lot of things to the county level, but some of that is a bit ambiguous when we're trying to do policy. Mm-hmm. And so even at a county level, if I'm trying to find a better way of maybe doing all of this where it's easier for us that are policymakers for our facilities. Mm-hmm. But I do understand the larger scope of what she was talking about. I get that. And so I will follow up and we're good. And I appreciate you checking.
Fantastic. What other questions do we have, panel? Peggy, I know that we connected yesterday and that you had a question or two.
Hi, yes, Peggy Kelly here, Kansas Head Start Association. Yes, thank you. And I did appreciate the conversation and also connected with Melissa, and I'm comfortable that we have Head Start understood where it needs to be, and the association is ready to be helpful in whatever way possible. So appreciate the efforts of both, of everybody. Melissa, thank you for your work on the panel, or the committee, whatever you are, task group, hard at work with this.
Awesome, thanks, Peggy. Any other questions, group? All right, well, I am sure that this will continue to be an ongoing effort with updates and other pieces. I'd encourage to continue referring back to those KDHE weekly updates and on the page that has the state virus plan. And I'm sure that this will be a really exciting and eventful and ambitious undertaking as we all work through the next several months together. So I'm really glad that we've got all of you as fantastic partners as we're taking the next step forward. So that brings us to the last piece on our agenda. We were visiting. I know that we have reflected a lot, and I really appreciated our conversation in September. I think that those meeting minutes, those are certainly something that I have used and referred back to. I was really glad to be able to share many of those reflections with the Children's Cabinet at their October meeting. And I think that there are really important reflections and insight in there that are going to continue to be helpful as we consider what's ahead. We know that there is an element of uncertainty. I had hoped that by the time that we met that there would be a little bit more clarity in terms of what federal things might be happening in the coming weeks and months and days. And we will stay tuned for more information on that front. But I do think that the reflections and the insights of this panel continue to be important as the state has to make, and as local communities, as any of us have to make decisions about being able to prioritize next steps and determining how we continue to react to the virus. So I wanted to, as we were considering this, we've got links in there to the minutes and the slides that we shared with the Children's Cabinet in October, if that's helpful. Since we met in September, it occurred to us that there's been some important things that have happened, right? The time frame was really short to be able to actually get much of the federal relief out to communities and then be able to get it done and spent by the December 30th deadline. And so we know much more now than we did in September, and it's hard to believe that it's only been 3 months since we that all of that has happened. So we wanted to make sure that we took the time as a panel to continue to reflect, to make sure that we are continuing to capture those insights and those pieces as we move forward. So we've got 3 questions here. We shared a survey, and these are the same that we shared in the survey. All totally own that that we got this to you at a busy time, and that there was not a lot of time for you to respond. And so I'm glad that we were able to preview some of these questions, and I'm glad that we'll be able to discuss them today. You can see the 3 here, and we can go in order. I think that our conversation will, to some degree, flow between the 3. But you know, the first piece that we wanted to consider is, all right, where were the gaps when we are thinking about the programs that the state had available, and then the needs in your areas and in your local communities? Where were there places where you were like, gosh, I really wish that this program or this pot of money could do this thing and it can't? Or gosh, I've got this problem and it doesn't seem that there is a funding mechanism, a program, a piece to address it. Does that make sense? Do we have any thoughts on that?
This is Kelly France Langford, and I had one thought that's tied into the discussion earlier that Cornelia brought up around differing guidance. And one thing that I thought was challenging was that each community or county did have a different approach, different guidance. And certainly I understand the benefits of that. But the challenge, particularly for early childhood programs, is that we often serve multiple communities, multiple counties. And so having our providers being in and out of different counties, different quarantine guidelines has just been very challenging.
Kelly, this is Melissa. I would emphasize that that is a message the legislature needs to hear. And it would best come from you, from providers in the field, from parents and families affected, from all of you, because that was policy set by the state legislature that created that patchwork of 105 different approaches. And I think probably dials back to Lori's comments in response to Cornelia about KDHE not being able to do a state level, this is how it will be, because the counties do have that local authority. The CARES Act required the state to transfer funds directly to the counties and certain sized cities. So it has been challenging for all concerned. I certainly, in the circles that I am involved in with these funds, with working with the recovery office, will convey, but I think it's a message that you all need to reach out to your state legislators and share your experiences. Don't approach it as a complaint as much as it's important that you hear from us what this was like to deal with, because they have decisions to make in January. The current law that was passed in special session expires January 26th. So the time is now, and it is critically important that you connect to have a conversation, make it as positive as possible, and just share your perspective with them to help them better understand what those decisions mean when they're making them in the legislature.
Cornelia, let's go to you next, and then to you, Deanna.
Okay. If in fact there is new CARES money, available come the beginning of the year, we're very grateful that you expanded the healthcare. There was funds available to help with the health costs if people test positive in the industry or whatnot. You expanded that to cover any time off work that they had if they tested positive. But we actually have more people who have time off work because of quarantine than we have time off because they test positive. And so we had people that still, went unpaid, or were going to go unpaid unless we could find some grants or donations or something to be able to cover salary. And so if we could broaden that ability, should a new round of CARES money be available, to help with that, that maybe we could expand to that definition so that it's not just for for childcare workers who test positive, but also for those who are quarantined.
Mm-hmm. Amanda, just to clarify, that was a request. I will give Rachel Sisson credit for could not have fought harder to get that wrapped into that program. It was a limitation imposed that prevented us. We will continue to fight because we recognize what a hurdle that is to actually get people to honor a quarantine when they know they're missing wages. So thank you.
Right.
It's helpful to know that continues. It's not helpful that that's a problem, but it is something worth fighting for.
And Cornelia, I appreciate that we'll be able to pull these pieces into our minutes so that we've got something tangible that we're able to share as we're continuing to work on these kinds of issues. Deanna, would you like to go ahead?
I'll just add a little bit to what Kelly was referencing as far as, and I think others too, as far as the guidance coming from all the various counties has been challenging. But with respect to the Spark money or the application process was also extremely different depending on which county. And so in many of the smaller counties, I don't think really were able to move as quickly as far as their decision-making process. And so for some of like our decisions, we went more to our larger counties to try to, interface with them. And some, they just had very different processes. So I don't know if there's anything this group can, influence, but that was across the board. And I would just share yesterday, if any county numbers, our positivity rate is 65%. So we are not out of the woods by any means. So that's just shocking. So we'll be doing all of this for quite some time. So.
Gosh, thanks for sharing, Deanna. I keep being struck, and I know it's something that we know in Kansas, but you all remember that first finding of the needs assessment that geography really matters, right? I keep thinking about that in the context of this, of all of this, because I think especially as it's harder to travel, it's harder to kind of mix and be with people from different parts of the state. It's really helpful for us to continue to have these kinds of opportunities where we say, hold on, let me tell you what it looks like here in my hometown and here in my home county, so that we can keep that statewide perspective. So thanks, I appreciate it. And thanks everybody for that commentary. Do we have other pieces that we'd like to share, or other places where we're like, gosh, there's a gap? There'll be a second part to this in just a minute. So we know that many of these funds and programs either have already closed or not already closed, but have already kind of ceased or will be quite shortly on December 30th. Are there pieces as you're looking at that day on your calendar where you're like, gosh, I am really concerned that this thing is going away. It's been really helpful and I don't know what we're going to do without it?
I know we've wondered about the FFCRA leave that applies to employees that ends at the end of this month, which has given, and I know again that's only a certain segment of people, and they've been fortunate to have it, but it allowed, like for school employees, those additional days of leave that they had access to, and so that has applied. We've had many people that have needed to use that, so I don't know. That's the federal, I guess, too, isn't it? That decision. So, yeah.
Peggy, go ahead.
Me, I finally found the raise hand button. I think one thing I would like to just put out is for consideration is the need for continued support of remote access to families that are home-based. And I would really, really like to ask for that to be expanded beyond home visiting in the early childhood world. Classrooms are frequently having to go remote, often simply because of staffing. It's not that the center can't function safely, but there aren't enough staff available because of the quarantining to be able to meet ratios. And many of the families who are using, what would be classroom services simply don't have the remote support access or the cost to be able to support that cost. So just want to keep that in there.
Absolutely. I see a thumbs up from Melissa. Amy Gottschermer, would you like to go ahead?
Sure. This is Amy. I just wanted to add that if the CARES Act is renewed, that we would like to see the continuation of the remote learning grant for the child care providers to be able to offer that to students.
Thank you, Amy. Paula Neff, go ahead.
For me, I think that I'm very concerned. We had a meeting on Monday night with providers across the metro area, and just the costs have gone up and around the PPE. And I worry that if we don't have funding to help cover some of those expenses, people will water things down. I mean, they'll have to make some really tough choices. And, groceries are going up. Everything is getting more and more expensive. And if they have to take on the burden of that themselves, I worry about what that will mean for their programs.
Thanks, Paula. Any other pieces to share on that front? I think that brings us nicely, I'll combine these second two questions on here. What do we, I think that we kind of covered what's needed moving forward. Do we have any thoughts about do we have any thoughts on this where we were thinking we're gonna wait for this question? I don't wanna cut anybody off. So I know that for me, it is strange to reflect back on the last 12 months as we typically do in December. And it feels like it's time feels a little weird. And I don't know that I am in the really reflecting and learning frame of mind. So I really hope that some of you might be, because when we're thinking about, gosh, what lessons have we learned from the last several months that we want to carry forward, I think the piece that I keep coming back to is that we are all perhaps more resilient and tougher and more able to do things really quickly than we ever knew. And I think also that we are tired, or at least we can be, and that I feel very confident that we will continue to get through this and to move forward, but that it's going to be. We can do hard things, but gosh, we are going to need each other as we're continuing to work forward. So it's not terribly articulate. I don't know if that's a policy recommendation or a lesson learned that you can apply to a program. But that is my thought as I'm considering, what lessons have we learned where when we are sitting in December of 2023, where we'll say like, hold up, let's remember we learned something about this when we were going through a really hard time.
Hi, Amanda. This is Riva Waiwatis. I think that if there is a silver lining here, that childcare being an essential part of making our state workforce work, that has been elevated in a whole new way. So I think as we move forward with our advocacy work and our, our messaging about the importance of childcare, I think people are understanding that and hearing that in a whole new way. So if there's something to celebrate, I think that's definitely on the list.
Thanks, Reva. Thanks for the thumbs up. I see those. And yeah, I think that'll be something that continues to be important. Emily Barnes, would you like to go ahead?
Yeah, thank you. I want to kind of piggyback on what Reva said, that, first of all, I personally, as a provider, I have felt very supported by Child Care Aware through this process, checking it, what do you need, what supplies, things like that. And as we look forward towards coming years, being able, if in 3 years, I'm able to look back and say, we were able to have committed providers who were supported and able to engage in conversation on, these are things I needed, these were things that I did, and we listened. And so that's my goal, is that as we see the silver linings, we're also able to sit down and talk, okay, this situation didn't work, so we're gonna tweak here and work there, and this situation really did, and so we're gonna pull from it. And so it makes me excited to know, I think we really do have that ability to have these conversations and engagement, like I keep bringing up the point of, get providers engaged. And that would be the one thing I would ask, is make engaging with the childcare providers, whether it's, center-based, directors and their staff, or family childcare working in their homes. Just make sure that we're looking at that engagement and listening to each other so that we can work together.
Absolutely. Deanna, would you like to go ahead?
Yes. One of the things that I have just been amazed by is the creativity and resilience of our early childhood teacher provider folks. And I've seen it both in home visiting and also with our learn and play groups with the use of technology. I think that is something that we are going to continue to implement and use as part of our service delivery models, and particularly with some of our staff who are reluctant, or they're scared, or I don't know, they've kind of been forced to learn this and done really well with it. Once we problem solved, and each person needs, that's a time consuming piece right there. Here's how you plug it in. Here's how you use Zoom, but, and we've also really heard, this isn't across the board, but some of our stronger, learn and play facilitators have reported they have higher attendance this way than they even did in person. And so we're still trying to figure out what are those families and factors, that play into that. I think they all prefer the in-person, but they'll say, I benefited, it was fun. And we did things like dropping off at their porch the materials, so they had it in their house, that kind of thing. I'm sure many have done that, but, finding out a way, that worked. It's not perfect, but I think it's broadened people's thinking a little bit. And so we've really tried to celebrate people's efforts to grasp that too, because some have, I think the service providers have struggled with, and I think we're seeing some maybe retiring early. I know in KSDE's note, I read that the other day, more people have retired now that can. And so those broader implications over time, we will see.
Yeah, gosh. That first bit, I love the thought of being 5 years down the road or several years down the road of being wrestling with something new, whether it's adopting a new practice or designing something new, right? And being able to say, hold up, wait a second. We were able to get through a global pandemic. We can do this, I think is going to be a pretty powerful reminder. Peggy, would you like to go ahead?
Yeah, I think two things that I'd like to elevate. One is just the importance of parent voice and choice. It's just so much in view right now, with being able to allow parents to decide what they're comfortable with within the context of what's available in terms of home visiting. Is an in-person, safely distanced visit what that family really wants and needs, and can it be done? Or is the virtual really meeting the best need of that family at the moment? And I'm hearing across the state, just across that whole array of choices, people making those decisions based on their own needs. And I think that just making sure that we maintain that awareness within our program operations, that we can always make that happen. We do have the capacity to respond to that and meet those families' needs. And the other thing is just, and I think it's still emerging and we're far from really understanding it, but just the importance of attending to the mental health of our staff, of our parents, of our children, and how we really engage the resources within our state, as well as really beginning to understand and be able to document the limits of those resources. I think everyone on this call is well aware that we do not have the depth of mental health services in Kansas that we really should and need. And I think we can really leverage this experience to help document and possibly change that in the future.
Mm-hmm. Thank you, Peggy. I think that I'm sure that it very much varies by industry, but we're starting to think about, all right, when we're thinking about the next phase, like fall of 2021, what does that kind of process look like? And I think that mental health piece, really highlighting the critical importance of documenting along the way the needs, I think will be really important. Sarah, go ahead.
Sarah Rivers. I'm a parent, but I used to work in early intervention.
Mm-hmm.
And so I have a lot of friends who have switched to doing virtual visits. And then we've, on the flip side, experienced that because we chose full remote learning. And I have a preschooler. And I think two things that come to mind just around that is how quickly those early intervention providers adapted to that, and how much they've had to adjust, and how many of those visits, they're getting more parent engagement than they would have previously because the parents have to be really hands-on and involved. On the flip side of that, though, there are families that service model isn't meeting their needs. And so I work in an outpatient clinic, and I've seen an increase in the number of smaller children coming in for outpatient services, because at this point in the pandemic, they've now gone 6 to 9 months without an in-person physical person telling them how to handle their special needs child. And so now they need just a little bit more support. So there's that flip side of that. And then on the schooling side, it's been interesting to see, like Deanna said, how inventive some of the teachers have gotten and some of the different pieces there. So I think that's a kudos to many of those teachers, and many of our providers are a little bit older. And so that really has been a challenge for them. Even just to do a Zoom therapy session for my daughter has been way outside of their comfort level. But they've stepped up to the challenge and done that. And I think it's been a good experience on both ends. So just wanted to share those pieces.
Fantastic. Thank you, Sarah. Any other pieces that we'd like to share here? All right, we'll pull these together and we'll share these out in notes. As always, please feel very welcome if we don't capture something quite right. Feel really welcome to let us know, because we want these to be tools that we can continue to use now and in the future, so that we're able to share this information, and so that we're able to come back to it to make sure that it can be really, really valuable and beneficial. So we'll do our best to capture this well. The next piece, so we are doing really well on time. The next piece that we'd like to talk through is having a rather open-ended discussion of next steps, where we consider, and where this really helps us as a panel plan for the second half, or to plan for 2021 and plan for the second half of our first year. We'll have a conversation in January. We had mentally highlighted that as a time to be able to revisit our bylaws, or not our bylaws, but our role, norms, and procedures document, to think about whether there are pieces that we need to tweak, think about pieces where we need to adjust so that we can continue to do our work effectively. A big thank you to Chelsea. We'll also be considering how to make that language a little more easily readable. So we will be sharing those draft edits out when we share the follow-up for this meeting so that you can review. But so I've got 2 pieces on our list from earlier today. We know that we've got conversation that we'd like to engage in around recommendations for how state agencies can better engage providers on the front end as they are developing policies or as they are seeking feedback. And Emily, I appreciate, and Cassandra, I appreciate that you both have indicated that you'd be interested in working on that piece. We also have the kind of immediate Kansas beats the virus piece when we're thinking about how we can get public messages out to the general public to be able to encourage those healthy practices. Do we have, as we're considering our kind of running list of work that we have on our plate for the next several months, do we have other pieces where we'd like to add it to our collective to-do list?
Amanda, I don't know if this would be the right time, but, kind of discussing the possibility of recommendations, like the employer child care tax credits and workforce grants and maximizing, CCDBG, kind of where we might want to get going forward with ideas on that.
Yep. So Emily, as we're thinking about that, and we're thinking about the time frame for the next meeting of the Children's Cabinet, Melissa, correct me if I'm wrong, but I think the Children's Cabinet meets in February and then in April. Is that right?
Correct.
So as we're thinking about a time frame, Emily, are those pieces where obviously we can kind of, we don't have to go through the entire formal recommendation process to be able to share general feedback with Melissa, but if we're thinking about having the panel request that the Children's Cabinet take a particular position for this legislative session, I think we'd likely be looking at that February Children's Cabinet meeting as the time when we'd want to bring that forward. And Melissa's nodding. So that would be some work that we could do in January to be able to bring a recommendation to be able to have our January meeting work through that. And Emily, are we thinking that we would so let's think a little bit about what steps we would need to take either as a work group or as a panel to be able to do that. What kinds of supports or what kind of work together would be helpful?
I think what you're suggesting sounds good. And if maybe, putting it on the agenda for January, figuring out how we go forward. If that's something that Melissa's comfortable with, I think, again, coming back to, let's open up the conversation. Let's talk about it and see, how we need to go forward. And is kind of my stance as well.
Mm-hmm. Well, and something that we could certainly do as we're considering that, we could put it on the agenda and we could kind of develop the agenda a little bit sooner than we typically do, so that we can be publicizing that in the All In for Kansas Kids weekly email updates, and so that if people have comments to share, that they've got the Kansans Open Forum as that place where they'd be able to do that. Do we think, and here I am very open to the viewpoint of the panel, do we think that we need a group to do additional research on this? Do we think that we could send some information out to the full panel? Just what would we need as a panel to feel to feel comfortable in making that kind of recommendation?
I know I personally, go ahead.
Sorry, Emily. Amanda, for me, I think it would be really helpful if the Kansas Action for Children could give us a little bit more information on the tax credit for businesses. I know I'm not a tax expert, so I don't understand what that means to expand that. So I know they've been working on pulling some information together on that, and it would be helpful, I think, for us to educate ourselves on what we're actually recommending on that piece.
I can give quick background. There is an existing tax credit in statute that allows a C corporation to receive this tax credit. There is a defined ceiling on the amount of tax credits available from the state. It is very underutilized, and I know the conversation is really around how to expand who is eligible to receive that credit to help boost utilization. It won't affect the bottom line because the state already factors in that ceiling as if it were fully utilized. So that, I think that's the direction of that ask. It will help spur investment into the childcare sector from the private sector.
So I would feel confident betting that since they indicated that this is something that they'll be advancing in the legislature this year, that there's perhaps going to be work underway to develop testimony and develop kind of background issue briefs, that kind of thing. We could certainly make sure that that they've got the panel in terms of on their list in terms of people who need that information, and we could perhaps see if there was time for a more in-depth conversation, or we could add them to the agenda for the January meeting so that they could present that information. Amy, go ahead. Oh, you're on mute, Amy.
Got it. Sorry. My thought, I guess, was around is this money that is being underutilized a use it or lose it kind of a situation, you know, how it often is with budgeting. So beyond just maybe enlarging that, the people that can access the money, is there some language that we want to see utilized that would make the amount of money sustainable, so, or at least so that we don't lose it while we are working on trying to you know, get more people engaged to use the money?
It's in state statute that, you know, whatever the ceiling, I'm not familiar with the ceiling, but let's say it's $5 million in tax credits are available. It means in the budgeting process, the state has to build a budget with the assumption that it will be fully utilized. So no, I don't think it's a use it or lose it. It's a question of you know, the work that needs to be done to convince the legislature that expanding it to allow more people to utilize it is a good idea. So it might make the most sense to work with Kansas Action for Children around a game plan for what support for that. A, help educate on the specifics of it, and B, how can this panel help support that effort? Don't know if it's the sort of recommendation that the Children's Cabinet can advance from an advocacy standpoint that has to do with our statutory makeup, but I think coming up with plans for how to support the ask is a very important piece of work that we can be doing.
So Melissa, I've got a question for Melissa, and then Peggy, I'll on you. But as we're thinking about what, so I'm thinking about this panel as an advisory group to the Children's Cabinet, and so thinking a little bit about what would be most helpful for the Children's Cabinet in order for, we envision this group as being a technical group that can really get into some of these nitty-gritty details so that we can bring a recommendation to the Children's Cabinet, and they know that this group has done work to vet and make a recommendation. Go ahead.
Yeah, as I see it, I think developing the same way that the kindergarten transitions work was carried out, what you all needed was cabinet blessing to go forth and use that set of documents and protocols that were put in place through that work group. I think the same would be in line here, is helping bring forward unified messaging around this, and just making sure that as panel members, the cabinet is the point of that was to make sure that the cabinet was aware of what the panel was interested in putting out to the general public. I think this would be the same thing, that advocacy work done through the various organizations represented here, just making sure we're not surprising the Children's Cabinet that our recommendations panel members are saying X, Y, or Z in that capacity. So I think working out the shared understanding of what the ask is and some common advocacy talking points and positions, and then bringing that forward, that the panel sees this as a valuable legislative priority to support, and we can take it to have that discussion and then make it something that everybody has agreed on. Does that make sense?
That does, yeah. So panel members, as I'm thinking about the work ahead, one lesson learned or one piece around the kindergarten transitions recommendation is that document that we've got, that template document for how to develop a recommendation, gives us the helpful background pieces that we need to be able to present a tangible thing to the Children's Cabinet, and that it's helpful to do some work on the front end prior to our meeting. I'll say I'm very happy to help wordsmith with the group, but starting from a good, easy document is really helpful, so that you all have to have a manageable amount of patience with me as we're wordsmithing in real time on a Zoom screen. So Peggy, feel welcome to go ahead on this piece.
And I think I'm just trying to get my own head around this, from the world of our advocacy voice and how the panel does and doesn't have capacity to influence. And there's a number of us on this, well, a lot of us on this in this body who have the ability to offer testimony from our own organizations and from different points of view. And is there a both and? I mean, what really is the appropriate functioning of this panel, and is there a way to help make sure that alerts get out when there are particular opportunities to bring testimony or to carry certain messages, and to make sure that the talking points are consistent. Kind of that line between our own identity and our identity as members of the panel, and kind of some of those lines, because some people on the panel maybe are state employees, where that state agencies have a whole different, cannot do that kind of thing, yet as our private not-profit and other types of the parts of the world we can. So just kind of struggling in my own head trying to get around that, and if there's anything we do need to do to formalize that, or if it's better just to know that we always need to be aware of those lines and what they are.
Mm-hmm. I've got two thoughts there, and then Melissa and everybody else, I'm interested in your thoughts too. When I think about the role of the panel, one, I want to underscore and affirm, Peggy, something that you said, which is that many of you are in organizations where your organization has a perspective and where your organization has great capacity to advocate. And I do not in any way have an expectation that you need panel blessing to do that portion of your job. When I'm thinking about, when we're thinking about the panel and the ability to say, all right, we've got this body that's in our governance structure, we've got some legitimacy when we need to bring a recommendation to the Children's Cabinet, that kind of thing. That's, I think, where we're able to think, all right, when do we need to make formal recommendations, so that in future years that we've got that kind of standing. We went through a process, we developed a recommendation, and that's there as part of our early childhood system. So that's thought one. Thought two is that I want to make sure I certainly do not anticipate or expect that the recommendations panel will be engaging in legislative advocacy or taking kind of testimony or any of those pieces to the legislature. And Melissa is shaking her head. So I see that we are in good agreement there as we're thinking about what we might actually do as a panel. I'm not seeing that being a role of panel staff.
Yeah, and I would echo that. We can't because of state agency restrictions on what is essentially lobbying. But what we can do is help create the toolkit to inform around certain issues that you all who do have that freedom can go forth and utilize. I think there's value in unifying, coming to a shared understanding about message and value of certain topics, and that would be the work. And quite frankly, bringing other ideas. If people know of other types of things that would be helpful, then this is a great workshop just to spur some ideas and thinking. I would give the example of the cabinet's own recommendations. Last year, we had several times over, we made recommendations around providing basic supports to families. There is a reason for the vagueness of that language. We know that there are certain pieces of legislation that need to be amended in order to actually provide more supports for families and meet their basic needs. I can't articulate in a specific way through the Children's Cabinet what those things are. Our cabinet can support the need to think through the options for how to do that, but we can't advocate that statute, KSA, whatever, be changed in a particular way. So I would urge some caution out of this group as to what gets brought forward, but that shared thinking around generating some of these ideas and support in an organized fashion is welcome.
So my I wonder for the panel, I wonder if what we're seeking is maybe not for us to take a formal action on these particular policy options, but instead to use our time as a panel to engage in conversation, to be able to capture that in our minutes so that we've got that as a record, and to be able to use this panel and our expertise to be able to have a conversation at our January meeting to really understand the current policy in Kansas and what changes might be. And seeing nods and thumbs up. All right, we will plan on that, which means that I feel exceptionally confident that that Mitch is watching along on YouTube and that he has great opportunities to connect with folks on the panel. His email address was included in the comments that they shared. So if you would like to engage with them specifically between now and January, feel really welcome to reach out to them. But I think that given the timeline, it makes sense for us to not formal working group to be able to develop or draft a recommendation prior to January. In terms of those other two pieces, I think that the process that we had for the kindergarten transitions work group worked well, where we were able to send out information where we said, all right, here's for this, it'll be two, here's the two pieces that we're interested in working on, and please email Debbie if you're interested in serving on either of those, and then she can help coordinate scheduling. As we are thinking about the time frame, we know that the Kansas Beats the Virus messaging will be work that is underway in January, where we'll be able to share out information to the full panel, post it, and then provide an update in January and keep that piece moving forward. When we're thinking about a recommendation around how state agencies can best engage with providers as they're developing policy, I think that it's likely that that we'll want to. I'm not sure that I want to make sure that we give that the time that it deserves to make sure that we've got a really thorough recommendation. And so I'm not sure that having a draft recommendation done by January so that we can present it to the Children's Cabinet in February, I think it might make more sense for us to mentally plan on the April Children's Cabinet meeting for that. Or perhaps later. If we need more time, but do we have, but I want to make sure that we're kind of in agreement on that if we think gosh, we really need to get this done really quickly, that we can plan accordingly.
I think that the best things happen when they're not rushed. And so one of the things I think going forward is the idea, if we've got the Child Care Development Fund, working on the state plan and things like that, I think that, looking at what are the natural opportunities do we create a working group? Do we just look at, this is a natural opportunity for a conversation? And so I think we also factor that in. And so that way, then we're getting solid communication and solid collaboration.
Fantastic. Well, I think that makes great sense, Emily. And thanks also for highlighting that for many of us, January will be busy, as we're expecting that there will be work going on in the development of that state plan as well. So how about let's plan to gather interest in the panel in perhaps creating a recommendation at some point, and then we will consider who we've got, and that group can perhaps work on a timeline or consider next steps together. That's something, Peggy, that worked pretty well for the kindergarten transitions piece. And that was also a piece where we had a good long time frame before we needed something final, which was good. Do we have other pieces that we want to add to our mental to-do list, or other requests that you all have for the staff support as we're thinking about how we can support all of you in your work? All right, and Debbie, do you feel like we've got what we need from panel members to figure out next steps?
Yeah, I think so. And I'll have just watch for everybody to get in touch with me in the next few days about their interest in this, and then we can start putting those together.
Awesome. Thanks, Debbie. And Peggy, I love the hand raising feature. Go ahead.
You've created a monster. It just strikes me, and I don't know if how you feel about this, but this discussion of how to engage childcare providers in a way that they're able to participate is so important. And parents have the same dynamic. They're working during the day. Often they're not in roles where they can get away. Would it be possible to ask that group to also take the perspective of what's good for providers would be good for parents, and let's do an inclusive process?
Yes, I think that is a great point, Peggy. I appreciate you raising it. I'll also highlight for everybody, if you didn't get a chance, we'll include the link when we'll share the link out. But this week on Wednesday, the every other week Wednesday webinar focused on some of the work the Family Advisory Council, and was able to share some highlights from that piece. So I know there's fantastic work in parent leadership going and family leadership going on in many places of the state. I certainly appreciate it. Being able to hear Cassandra share and Soo-Kyung share some of the perspective from that particular group. So we'll make sure that you've all got the recording to that in case you missed it. So that leads us nicely as we're thinking about requests for upcoming meetings. You all can rest assured that when we're thinking about follow-up from today's meeting, we'll certainly continue to highlight or TBD. We will understand that that the virus or that the vaccine is something that we are all interested in as we continue moving that piece forward. And then we've got some plans around thinking about tax credits in January. Do we have other requests for upcoming agenda items? All right, well, you all know how to get a hold of Debbie and me. If you ever do have a request on that front, feel really welcome to reach out and to highlight those for us so that we can continue to plan our work. We've got a list of upcoming meetings. They'll all be virtual for the foreseeable future. And we can see the list on there. We'll note that the Kindergarten Transitions Work Group is meeting on January 6th at 11 a.m. And if there are other work group meetings that get scheduled, we will make sure that those are included on our webpage and announced in those weekly emails so that there has been public notice around that. But we will have our next meeting on Friday, January 15th at 9 a.m. and then the Children's Cabinet and we'll meet on February 5th. I'll highlight for anybody who might be interested, and as a reminder, that early childhood stakeholders group, when we're thinking about the place where anybody in Kansas can join, we all have a critical stake in the early childhood infrastructure, and we want to make sure that there is opportunity for everyone to feel a part of that process. That group meets on February 5th from 1:30 to 3. Unless there are any other pressing pieces that we need to share, that's all we have for today. Thank you, really and truly thank you. We appreciate you, and we appreciate the opportunity to work with you. I hope that the next couple of weeks bring you some opportunity to relax and to find some peace and some joy. And I think we've all got a little bit more hope maybe than we did several weeks ago. So I hope that each of you continue watching all of the videos and all of the pictures of people getting the vaccine and considering how exciting that is that we get to see that before the end of the year. I really appreciate all of you. We'll see you soon. Thanks for joining us today.